Welcome to Practical Thoughts channel. In this video we talk about antisocial and paranoid personality disorder. The symptoms of personality disorder include different variables, including emotions, cognition, motivation, self-concept, and the personality traits mentioned in Practical Thoughts channel. A common theme of several personality disorders is related to maladjustment of these common motives, especially intimate motives and power motives. One of the important variables is the extreme lack of intimacy motivation, which will be manifested in certain personality disorders. The other variable is the super desire for power. When reaching a very high level, it will lead to another maladaptive personality disorder. Other motivations can also be seen in personality disorders. For example, in narcissistic personality disorder, you will find the need to be provocative and praised. Patients with obsessive-compulsive personality disorder show extremely high requirements for order and detail. Cognition provides us with the necessary foundation for a better understanding of personality disorders. Cognition refers to the mental activity in the process of perception, interpretation, and planning. These cognitive processes may be distorted in personality disorders. For example, certain disorders are often consistent misinterpretations of the intentions of others. Personality disorder usually involves a kind of imperfect social judgment. For example, a person with paranoid personality disorder thinks that others are against themselves. A person with performance personality disorder thinks that they will be liked by everyone. Suffering from borderline personality disorder of people see unintentional comments as signals of rejection, criticism. In short, every personality disorder involves a distortion of other people's perceptions or social perceptions. Self-concept is a collection of a person's self-knowledge. Most personality disorders involve distortions in self-concept. Most of us can establish and maintain a stable and true self-image. We understand our own point of view and understand our self-worth. Know the life you want. However, many people with personality disorders lack stability in their self-concepts. They may feel that they are an empty shell, are afraid to make decisions, or need to be constantly affirmed by others. Empathy, that is, understanding the inner feelings of others, is an important interpersonal skill. Most personality disorders involve a lack of empathy. For example, people with personality disorders either misinterpret others or do not care about their feelings at all. Next, the Practical Thoughts channel introduces two personality disorders that have a greater impact on people. The first is antisocial personality disorder. This is the most harmful personality disorder. People with antisocial personality disorder usually ignore the feelings, rights, and happiness of others. They often do not abide by the law, order, and morals, shamelessly, habitually lie, cruelly treat animals, threaten others, destroy public property, etc. Once a person with this personality disorder has formed a stable personality as an adult, the situation tends to deteriorate. Problems such as lying, sabotage, theft, and fights can evolve into serious problems such as robbery, brutal injury, and abuse. We often hear in the news that a child, usually a boy, treats other children very cruelly and has no regrets afterwards. This personality disorder is often manifested in girls as often lying, running away, playing truant, and even prostitution. What's more frightening is that antisocial personality disorder will deceive and manipulate others and guide others to commit illegal behaviors. A common feature of antisocial personality is impulsivity, which is usually manifested as a lack of prior planning. They will implement behaviors that do not consider the consequences. Another characteristic of antisocial personality is irritability, and even minor problems and frustrations will make it react fiercely. A few coins swallowed by a vending machine are enough to make him angry. They also tend to be aggressive, especially towards those closest to them such as spouses or children. Irresponsibility is another key feature of antisocial personality. They are prone to boredom and cannot bear the pressure of a monotonous or boring life or work. They will quit their job with a heady head, but have no plan to find the next job. Their economically irresponsible performance is that they often owe money and fail to repay, or borrow money to pay off another person's debt, rather than relying on their own efforts to earn money to repay the debt. They will squander the money used to support the family, or use daily expenses for gambling. The Practical Thoughts channel needs to remind you here that some people with antisocial personality disorder are good at hiding their true nature. They are eloquent, personable, and very sleek in social interactions. They are confident and make a good impression when they meet for the first time. Many people are deceived because of the charm displayed by antisocial personality, and sometimes even professionals, such as police and psychologists, are not immune. Such antisocial personality is known as master fraud. Indifferent social attitude is also one of the characteristics of antisocial personality. Such people have no regrets for their actions and always find all kinds of excuses for their crimes. They will stubbornly believe that the victim deserves it. Antisocial personality disorder is extremely vengeful and aggressive. Having said this, did you think of a role in the series Prison Break? Yes, he is T-Bag. But here is a special point: when we evaluate antisocial personality disorder, we need to consider the social environment in which the individual lives. Because in some specific environments, what is considered bad behavior in ordinary environments is a self-protection strategy here. For example, in certain areas with extremely high crime rates, normal people's antisocial attitude towards this environment will protect individuals from being harmed. Therefore, antisocial labels are only applicable to behavioral patterns that exhibit functional disorders, rather than immediate responses to the social environment. For example, those young immigrants from war-torn countries who regard resistance and attacks as a way of survival have changed their previous antisocial attitudes and behaviors after reaching a peaceful environment. They should not be regarded as having antisocial personality. When judging whether certain bad behaviors are personality dysfunctions, one must consider the individual's living environment and background. Another type of personality disorder that needs our attention is paranoid personality disorder. Paranoid personality disorder is manifested as extreme distrust of others and viewing others as threats. They always baselessly believe that others are using and deceiving themselves. People with paranoid personality disorder think that they are always hurt, and they always doubt the motives of others. They often misinterpret surrounding social events. For example, they will interpret other people's random comments as malicious or threatening comments. People with paranoid personality disorder often hold resentment towards others for a little thing. Pathological suspicion is a common manifestation of paranoid personality disorder. For example, a woman who is pathologically suspicious, even if she has no evidence, will suspect that her husband or couple is unfaithful to herself. She will tirelessly search for evidence in order to verify her guess and restrict her partner's movements or repeatedly question her whereabouts. She will not easily believe her partner's explanation or loyal confession. People with paranoid personality disorder hurt those who threaten their beliefs. Their controversial and hostile nature will provoke a combative response from others, and this combative response will in turn verify the paranoid's initial guess that others are against themselves. Extreme suspicion and ideological irrational make it difficult for them to get along with others. In addition to the above two personality disorders, there are borderline personality disorders, and the lives of such patients are characterized by instability. Their interpersonal relationships, behavior patterns, emotions, and self-images are unstable. Panic, anger, despair, and other emotions will be triggered by interpersonal events in them, especially when they are abandoned or ignored. There is also a performance personality disorder. This type of person is usually overly dramatic and likes to be the center of attention. They love to show personal charm, usually behave frivolously, and most of their behavior is provocative. People with performance personality disorder usually express their opinions exaggeratedly regardless of the occasion. Their opinions are superficial and fickle, so it is difficult for them to get along with others. In addition, there are narcissistic personality disorder, avoidant personality disorder, dependent personality disorder, obsessive-compulsive personality disorder, etc., but they are not as harmful as the first two types, and they are not too aggressive, so we should spend more energy to pay attention to the antisocial personality disorder and paranoid personality disorder around us. Our channel considers some interesting questions from the perspectives of social engineering, personality psychology, logic, statistics, genetics, and so on. We hope you enjoy the Practical Thoughts channel. By discussing useful knowledge and building consensus, we help each other reduce anxiety, doubts, and unnecessary fears, and improve our ability to defend ourselves when encountering fraud. A broad consensus is an effective guarantee for maintaining a good living environment. You are welcome to share different views. Your support is the biggest motivation for our efforts. Thank you for watching our video.